My name is Bonnie Moon. I have been a registered nurse for over 17 years, and my background is in oncology, rheumatology, education, nutrition, IV vitamin therapy, holistic medicine, aesthetics, medical business entrepreneurship, and business innovation. I am currently a Doctor of Nursing practice student at the University of Massachusetts Global. I created this educational video for my doctoral clinical scholarly project in an attempt to improve clinical outcomes for primary care providers, especially in busy clinics, with patients who have obesity in the United States. As a provider of care, it should not be news to you that obesity is a national health crisis affecting almost half of Americans. With obesity and obesity-related comorbidities as the leading causes of morbidity and mortality in the United States, I am sure that this is an ongoing concern for you and your patients in your clinic. For primary care providers in busy clinics, it seems as though there is not enough time out of your 20-minute patient care visit to fully address the multidimensional facets of caring for a patient with obesity. Reminding a patient about their weight issue and encouraging them to eat better and exercise more is not working. There is another issue to be aware of. Most advanced practice nurses are overweight and obese, and around 40% of doctors are overweight and 23% are obese. This results in less providers addressing this topic with their patients. A study showed that 76% of nurses are not talking to their patients about their weight. It is important for us to model what health is for our patients. Addressing our own weight issues can help us to be more comfortable with discussing obesity with our patients. We must practice what we preach and serve as an example of health as leaders and providers of care. The CDC recommends that the best treatment for obesity is behavioral modification counseling therapy. I have done some digging and found that the 5 A's is a framework that has been successfully used for smoking cessation and can also be used for obesity. The 5 A's framework: assess, advise, agree, assist, and arrange, has been modified to be used by providers for their patients' obesity counseling and has shown success for behavioral modification and weight reduction. In a 2010 study that taught primary care provider residents the 5 A's approach, the results showed that more than half of the patients were motivated to lose weight, eat right, and exercise. In a 2011 study, doctors were assessed to see how many of the 5 A's they were currently using. Results showed that the majority of doctors are not using all of the 5 A's: assess, advise, agree, assist, and arrange. Doctors are only using the first 2 of the 5 A's, which is simply advising the patients to lose weight. In a 2016 study, it was shown that the quality of obesity counseling improves when more of the 5 A's, assess, advise, agree, assist, and arrange, are used in a patient care visit. It is my intention to increase the usage of all 5 A's, assess, advise, agree, assist, and arrange, to improve the quality of care for our nation's health leaders. As a primary care provider, you have the ability to improve the biggest health disparity in the United States: obesity. In order to know how to use all of the 5 A's, I will go through each 5 A and give examples on how you can use it in your patient counseling session. Keep in mind that every aspect of obesity cannot be fully addressed in one 20-minute visit, and topics from each section should be split up between multiple visits. Simply put, as providers, in order to assess, advise, agree, assist, and arrange, we first assess the patient's condition. Then we advise treatment options. Then, together, we agree on actions to take and goals. And then, as provider, we assist towards the treatment actions and goals. And lastly, we arrange any referrals, testings, and follow-ups. The first 5A is assess. This step is very important. In order to fully treat a problem, the entire cause and effect must be addressed. There are many factors that have been discovered that can contribute to increasing a person's weight. As you know, there are many different body types, muscle to body fat ratios, placement of body fat, and metabolisms. There is no one size fits all when treating obesity. When assessing, we investigate all factors that can increase unwanted and unhealthy body fat. For example, we assess environment, culture, family dynamics, economic resources, weight, abdominal circumference, BMI, body fat percentage, distribution of body fat, exercise habits, eating habits, sleep schedule, toxicity in the body and the environment known as obesogens, levels of inflammation, infections including adenoviruses, hormone balances, vitamin levels, vitamin supplementation, food allergies, food intolerances, environmental allergies, current medications, current comorbidities, family history, physical ability, injuries, stress, psychiatric history, current depressive or anxiety symptoms and coping mechanisms, stages of change, social history, non-prescribed medications and medicinal therapies, other influencing factors, and any previous attempts to improve their condition. The second 5A is advise. As a provider, this is where we use our level of education, expertise, and experience to advise the best treatment options and goals to first strategically focus on. What options are the most feasible, yielding the greatest outcome? What treatment options can you plan to address in future visits? Advising changes in physical activity that gradually increases in time spent exercising, number of days per week, and cardiovascular intensity can prevent injury. Advise diet changes like eating smaller portions, avoiding inflammatory foods, cutting out dairy, gluten, sugar, processed foods, reducing animal fats and all trans fats, and opting for organic foods. Encourage healthy foods like dark leafy greens, dark berries, lean meats, oatmeals, beans, nuts, and legumes. Consider hormone replacement therapies, detoxes, chelation therapy, oral and/or intravenous vitamin therapy, fat burners, thermogenic supplements, appetite suppressants, probiotics, and digestive enzymes. Advise ways to reduce obesogens exposures, including plastics, chemicals, and hormone disruptors. Advise ways to decrease stress and improve sleep. Suggest treatment options for comorbidities, including psychosocial. Advise ways to improve musculoskeletal injuries. Give pros and cons to medications and surgeries. Give and review goals that reach 5 to 10% of body weight loss over 6 months. Answer any patient concerns and questions. Use sensitive language that does not offend the patient. Have sensitivity for cultural considerations. The third 5A is agree. No matter how much we would like to just give the doctor's orders, if the patient is not on board and does not agree that the intervention will be both effective and doable, it is completely futile. Imagine that you and your patient were on a medical board together and the topic for the meeting was reducing body weight. The main implementer must agree even if the lead scientific advisor says that this is the best intervention. This is a team-focused plan of care, not the ego-based direction because I'm the doctor that providers of older generations have used. So, together with the patient as a team, agree on the patient's preferences for behavioral change options that you have both discussed. Help the patient pick 1 to 3 mutual behavioral change goals. Give a written diet and exercise plan prescription. Make sure goals are SMART. That's SMART. Specific, measurable, achievable, realistic, and time-bound. And make sure you are updating these goals every patient visit. The fourth 5A is assist. What barriers to change does the patient have that needs your assistance? Can some of the assistance that is needed to be delegated to others within their support system? Empathetically verbalize your support for the patient's goals. Assistance through verbal support is just as important as physical support. Then offer the patient support services like group therapy, a nutritionist, cognitive processing therapy therapist, physical therapy, etc. The patient may need medications, surgery for an injury, or bariatric surgery if all behavioral modifications have failed and the risk outweighs the benefit. Use motivational interviewing skills to assist the patient to move through the levels of change. This will help them move to a higher stage of change to ensure a better behavioral change response. Be innovative in your approaches and encourage the use of technology through applications and online content to assist them to lose weight, eat better, reduce stress, and exercise more. Lastly, the fifth 5A is arrange. With a refreshed motivation to change and mutual goals set, make all the arrangements that will generate continued success. Frequent follow-ups are important to arrange for patient success to lose weight. Arrange telehealth visits between in-person visits to increase accountability and convenience for the patient and for you as the provider. Your patient may need for you to arrange a referral to a weight management clinic. Be aware of community resources and commercial programs that you can arrange for your patients. Remind the patient that they can arrange to have a family member or friend come for social support in their plan of care for future visits. The 5A's framework for behavioral cognitive therapy is the best treatment for busy primary care providers to use for patients suffering with obesity. The easy to remember 5A's mnemonic: assess, advise, agree, assist, and arrange assist you, the provider, in your patient care visit in ensuring the patient gets the most value out of your time to decrease their weight-related comorbidities, and increase their quality of life. Oh, and of course, saving lives. This is Bonnie Moon, and I'm a doctoral prepared nurse practitioner student. I hope that you have enjoyed my clinical scholarly project, educational intervention video, and that your current use of 5A's will increase because of this online education. Refer back to this video as many times as you need to improve your obesity counseling skills. My references are listed for you. Thank you for all that you do to improve the health of Americans. God bless you.